Hi, everyone. I'm Danny from First Healthcare Compliance, and with me today I have Chris Jones-Bartley, who is the president and founder of Healthcare Management Systems. How are you today, Chris?
I'm doing great. Thank you, Danny.
Great. Well, I just wanted to talk to you a little bit about what you guys do at HCMS, and kind of was hoping that you could explain for us the story of HCMS, how you guys came to be, and kind of the foundation of what you guys do.
Absolutely. I began my career doing medical practice management actually while I was in college. I was studying chemistry and pre-med, really thought that's the direction I wanted to go, but found that my true love was using analytical and management skills. So throughout college, I actually worked my way through working with physicians, helping them start practices, working in hospital emergency rooms, and learning from the ground up. Then once I graduated, I just naturally moved into practice management and consulting work. So I started our business, Healthcare Management Systems, back in 1984. And at that time, there was a big need. This was an unaddressed area. So we worked a lot with startup practices and also practices in crisis. So we've done everything from the beginning, doctor just out of school, to practices that were filing bankruptcy or victims of embezzlement and getting them back to being solvent. We've done this now for over 30 years, and we learned probably about 10 years into the process that consulting was one thing, and it's wonderful, but what the practices needed, the small practices, is they needed to be able to outsource a lot of these complex administrative tasks to experts. And in a small practice, they don't have the resources to pay for that kind of expertise. So at that point, we developed our billing company, and we also provide contracting and credentialing services. And that was about probably 20-plus years ago. So currently, we provide those services and some subscription services for primary care and subspecialty practices. So at this point, we'll manage everything, every phase of a medical practice, from startup to retirement.
That's great. So it's kind of neat to hear about where you guys started and how you got to where you are now. So how would you say that you guys differ from other billing companies with all the services you offer?
The biggest difference that Healthcare Management Systems offers is that we believe in customized business solutions. Our mission is really the support of private practice. So in that process, we've realized that there is no one-size-fits-all. We assess each client's practice and create individualized plans and recommendations for them, all designed to increase their profitability and efficiency and their effectiveness. Clients, they can choose to either adopt the entire recommended plan or they can choose from a menu of a la carte services. It really depends on the client. So each client gets their own customized service plan based on their needs and their budget. We don't have fixed rates, for example. It's very customized. In addition to that, we focus on education. All of our employees receive continuous training and education, so they're current all the time with the ever-changing standards and regulations in medical billing, in contracting, and all the issues that relate to practice management. Our employee turnover is very low. We treat our team the same way we treat our clients, as individuals. And because of that, we have long-standing employees and can provide a higher level of service to our clients. The other thing that sets healthcare management apart is our technology is always cutting edge. We are, I would say, 95 to 98% paper-free. We're 100% HIPAA compliant. We're very focused on compliance for ourselves and for our clients. And if you look at our website, that's one of the things you'll see. We publish our compliance plan. We stress how important that is, and we support our clients in that process. The other thing that differentiates us is our customer service. We have team members on both coasts and in between. And because of that, we can offer availability to our clients that not everyone can. In addition to that, we assign one account manager for each client. So that client gets to know their account manager well. They always have someone they can communicate directly with. And we have a great line of authority. So if that account manager needs support, she has a supervisor to go to, and then supervisor, on up can ladder up to me. So the clients have access to our entire team. which is very valuable for the clients. We consider ourselves true partners in the practices, so we work continuously to not only educate our staff, but also our clients. And that is a huge value for our clients who, again, they don't have time to go figure out which regulations affect them. A great example right now would be the MACRA and the MIPS change in value-based reimbursement. Each client has a different situation. We're in a position to analyze that for them and let them know the easiest way, most efficient way for them to meet that criteria and maintain their revenue.
So what do you see as the future of healthcare management systems? It sounds like you guys have a great foundation and you've got everything figured out for what you're doing now, but with everything that changes in the healthcare industry, what do you see the future looking like?
Well, because we have been in business for over 30 years, we've seen a lot. And a big part of our success has been our motivation and work ethic, but it's particularly because we have a continuous eye on the state of the industry. We look at what's coming down the pike. We adapt to the industry, not the other way around. So this is part of our big responsibility to our clients. An example would be concierge medicine or direct primary care. These are both relatively new models in the healthcare industry, and we have an entire department that works exclusively with those types of practices and provides the kinds of service that they need. So, for example, with concierge, they have specialized billing needs, and they have white glove types of services that they need to have for their patients, and we can provide that.
So you mentioned concierge-style medicine as one of the specialized areas that you guys are kind of an expert in. What other types of providers do you usually partner with?
We work with a broad variety of providers. We work with primary care. We work with procedure-based specialties. We work with surgical specialties, some mental health. So a large range.
That's great. It sounds like you guys really have a lot of things kind of figured out, and you really are experts. So if some of our listeners wanted to contact you guys, what's the best way for them to reach out to you?
The best thing would be to call us directly, and our number is 707-255-8825. And they could speak either with me or my Director of Revenue Cycle Management, Amy Tucker. And certainly can look at our website, which is hcmsnapa.com. And we chose that website because we are based in Napa. And one of the perks for our clients is they get to come and visit us here in the Napa Valley, and we always enjoy that.
Oh, well, that sounds quite wonderful right now. All right. Well, was there anything else you wanted to share with our listeners today?
Well, the one thing I would like to share is just why isn't a billing company important to a practice? And I touched on it. And again, this is our mission, is to support private practice. But what we see is so many private practices are closing their doors. They are selling out to hospital systems. We even have insurance companies now buying up private practices. And the physicians are overwhelmed with the burden of trying to maintain a private practice, obey all the regulations, fit into everything they need to do, and still be profitable. We are the avenue to help them with that. We do have the expertise. They can get the level and the quality that they need to have without needing to do it inside of their office. We work with businesses, practices all across the country, so location is not a barrier anymore because of technology. We have clients who have been with us actually from the beginning. We still have some, although some are now retiring, for 30-plus years. So the importance of why you would want to outsource these functions in order to stay in private practice would be the last thing I would want to leave our listeners with.
Great. Well, thank you so much for your time today. I really appreciate you taking the time to talk with me.
Thank you,
and I hope you have a great rest of your day.
Excellent. Thank you.